people in traditional male friendship groups who maybe meet up a lot and they go to the pub and they watch the football and all these things, and they've got, major things going on in their life, and they don't have female friendships and they don't talk to their male friends about it because that's just not what they do. Men who basically, really do suffer in silence and don't talk to anyone, because I just think how hard that must be, and it's not a choice for these people, and this is not rare, is it? This is kind of the norm.
So, hello, welcome back to the Founders Flow podcast. Of course, it's myself, Chloe, and Layla. And this week, as a special guest for Men's Mental Health Week, we are joined with Henry, who is a doctor, right? You're still a doctor within the NHS as well?
Yeah.
Yeah, amazing. So we are going to be chatting all about men's mental health and how partners can support men with mental health, but also like how do we get people men talking about fertility and mental health, and how do we make these conversations a little bit more taboo? So Henry, could you kick off and just telling us a little bit more about yourself, please?
Yeah, so my name's Henry. I am a man. I started medical school about 11 years ago now. And then how it is normally in the UK is you have kind of preclinical and then clinical years. So you have a couple of years preclinical and 3 years clinical, where you're kind of in hospitals. And in the first couple of years, you're learning about anatomy, physiology, medication, pharmacology, all these things. And we also had a UCL, a BSc year. So you did a kind of mini science degree. I did that in global health in my third year. And then fourth year was the first clinical year. And I think very quickly just became quite disillusioned with how kind of little I think we were able to help patients with the kind of social and psychological components of their care, which for me in hospitals seemed like it was everywhere, underlying every physical health condition in some way. There was this social and psychological component. Not that all physical conditions obviously caused by social or behavioral or psychological things. A lot of them are, but a lot aren't. But there's always this kind of component. And I think as doctors, we're not trained to be as good at dealing with that side of things, or at dealing with the kind of root cause of what's going on. And I kept on seeing kind of patients coming into hospital and then, getting their biological problems sorted, but then sending them back out into the conditions where they kind of became unwell. And I also was just always fascinated in those kind of more psychological underpinnings of health. So after a year of clinical, I applied for some funding to do a PhD in something called social prescribing, which was looking at these factors, looking at the kind of social components of people's health, looking at the evidence base for kind of referring people to community groups and activities to support their mental health. So the med school let me take 3 years out to do that PhD, which was also at UCL. So I spent about 10 years of my life at UCL. And then I came back and I finished the last 2 years of med school, which was a bit of a struggle after a few years out, but I managed to do it. And then, I've been a doctor here down in Kent for just under a year now. So that's kind of a bit about me.
Wow, that's so interesting. I'm just going to have to ask, what were your key findings from your PhD?
Yeah, so there were a number of things I was looking at. So I was looking at kind of mechanisms underlying the mental health benefits of these community groups. I spent a lot of time with different community groups, a football group that supported people with substance misuse problems, a community gardening group, a reading group, and a mental health choir. And we basically found that these groups kind of act through many different mechanisms to overall kind of reduce anxiety and depression levels. So biological mechanisms, behavioral ones, social and psychological. And basically I just examined the many kind of hundreds of different mechanisms that do contribute to that. So it's not just kind of one thing with these groups, it's that there's a kind of complex system of mechanisms that's going on in people, and you can kind of split these up into those categories, but within those categories there's a lot of different mechanisms that have their own evidence basis for. So it's quite a complicated one to kind of put in one line. But that was one thing I was looking at. And then because it was during the pandemic, I ended up doing a lot of kind of research on COVID and mental health, and looking at kind of mental health among healthcare workers and things like that. So some of my PhD got sort of pulled in that direction a little bit as well. So
interesting. Layla, did you want to kick off, or do you want me to?
Yeah. No, I was just reflecting on what you were saying, actually, because thinking about my own mental health issues when I was going through all my fertility and stuff, like 5 years, 6 miscarriages, it was a nightmare. And, you know, just the withdrawal, I think. I mean, I suppose mental health issues are that the trigger for them are different for everyone, aren't they? It could be stress, it could be overwork, could be, you know, death in the family, grief, whatever. But everyone deals with them in such a different way. And it's interesting that you're talking about community groups, because my reaction to my situation was to withdraw, and that just caused a lot of more like depression, loneliness, anxiety, social anxiety. So, you know, it's interesting you're talking about kind of those community groups that bring people together who are suffering from mental health issues. That's just the one key thing, I think, is just even having people around you who know what you're going through.
I think as well, so like I do CrossFit as well, and the amount of times people come up to us and say, like, you've changed my life. And a lot of the time it's literally it's not the workout. The workouts aren't changing people's lives.
It's not the exercise, it's the community. And just
it is the community.
And even having like knowing that you've got something scheduled in your diary and it's weekly and you're going to see the same people. And I was reading some, oh gosh, I can never remember. I remember all these stats and I don't know where I found them. But it was talking about how it takes like 200 hours to form a good friendship with someone. Oh, I know, it's the Mel Robbins book, the Let Them Theory. And it was talking about how, you know, and that's quite a lot of time you need to spend with people to like bond and form relationships. So those community groups are invaluable if people are feeling lonely or have mental health problems, aren't they?
For sure, yeah. And then my partner does CrossFit as well, by the way, so I know I know that world. But yeah, provides enormous community and meaning in her life as well. And I think, yeah, like what you were saying, Layla, I mean, I don't think social prescribing or community groups in an intense way is for everyone at every point in their journey or mental health journey. For some people, as you say, like it might not be right for them at that moment in time, or they might benefit from a kind of lighter touch group. One of the great things in some of the groups that I worked with was so for example, the gardening group, there was a men's shed in one of the gardening group. If people don't know what men's sheds are, I'm sure you guys do, but it was a concept set up in Australia to get men struggling with certain kind of mental health issues to kind of meet up and do something, I guess, stereotypically masculine. So maybe kind of building a shed, or working with tools, or doing some gardening, something like that. So kind of bonding over this thing that was going on in each other's lives, but not necessarily, you know, talking about it straight away, but doing something that still connects them with other people over this kind of shared thing. And so one of the groups I did was a men's shed within a community gardening charity. And all the men had kind of various things going on. A lot of them had kind of significant mental health challenges or bereavement, things like that. And I'll be honest, you know, there wasn't a lot of talking about emotions in that particular group, but it was so valuable for these men, you know, to get out of the house and meet up with each other several times a week, you know, several of whom didn't have many other kind of, you know, didn't have a large social network. And, you know, it is that sense of community and connection over a shared activity. Some of the groups that I did were more emotionally connecting, you know, a reading group which was based around the concept called shared readings. It's an organization called The Reader, and that really is about reading together, reflecting on your emotions, occasionally bringing in your own life, stuff like that. So it's a lot more kind of a lot more of that kind of emotional kind of literacy side of things. But you know, everyone can kind of heal in different ways at different times, can't they? And the great thing with quote unquote social prescribing is that you can find groups that will suit you at whatever point you're at in life. You might have one where there is a lot of chatting and a lot of emotional support, or you might have one where you're literally meeting up in a garden and you've all got a task that you have to get on with, and you're just getting on with that, but you're surrounded by kind of peers doing that.
Yeah, that's really cool. I love that. And I think, so we know that like 1 in 8 men in the UK experience a mental health problem, yet 40% have never really spoken about it. So that's also really cool that there's those like examples out there that you don't have to necessarily speak about it. But why do you think that men are still suffering in silence and maybe still don't want to talk about it, like even with their partners? Why do you think that is?
I guess it's because we're dealing with something that's been going on for so many kind of centuries, this philosophy of what a man should be, right? That's kind of rooted in, physical strength, not showing your emotions other than anger. Anger's okay, but all the other emotions are invalidated. Growing up in the schools that we grow up in, and, the language that, boys are using together is still the same as it was when I went to school. And I know that from doing some work for a charity that goes into schools and facilitates kind of conversations with young boys. And it's men that come in and do these workshops about, what it means to be a man, and certain language we use around men versus, women. For example, why is a boy called a player if they're getting with lots of people, and a girl is called a slut or something like that? It's a very kind of basic, obvious stuff that we should be talking about and breaking down, but a lot of that is still going on. People are still using gay as a criticism and all of these kind of things. So I guess we're still quite recent, aren't we, in terms of mental health in general? Like, mental health was, I'm about 30, like, mental health was not a thing when I grew up at school in any sense. Emotional health was not a thing. We weren't taught about emotional health and things like that. So it's only really been in the last 10, 15 years or so where we are talking about mental health a lot more, and also talking a lot more about what it means to be a man. And so it's actually very, very recent, isn't it? So in terms of why it's still not better, I think it's because we're working against kind of centuries of very embedded kind of culture and philosophy around these things. And yeah, we've got a long way to go. I mean, I think you're seeing more and more people in the public eye, men in the public eye, who are able to talk about their emotions a bit more and talk about their mental health. You've got the guy from Rizzle Kicks, Stormzy's, been very vocal about it. Lots of actors, things like that. People in the public eye, talking more openly, which is brilliant. But then you've also had the flip side of that, with the understandable critique of masculinity and phrases like toxic masculinity that, in recent years, that have meant that young boys have also been growing up thinking they're inherently toxic. And then, of course, what fills that gap is voices like Andrew Tate and things like that, which are advocating for the complete opposite approach, that you shouldn't show weakness, and that, a man's job is to provide, and all of these kind of just show your strength and not show weakness. So you have kind of you have different voices, don't you, at the moment, unfortunately. But
yeah, the whole Andrew Tate thing's crazy. But I was really surprised when I was researching the stats on men's mental health that I just had no idea 75% of UK suicides are male, and only 36% of NHS therapy referrals are for men. So, how do you know if your partner's struggling if they're not talking about it? What signs do you need to look out for, and how do you think you could encourage men to go and seek help? Because men are much less likely, obviously, to even go to the doctor, let alone be referred.
Yeah, it's tricky, isn't it? I think it'll vary from person to person, but people might show that they're struggling in different ways. And if male or female, but I guess especially men, struggling to kind of find the words to say what's going on. It might come out in other ways, as we know, kind of it might come out in anger or in not looking after yourself, or there's lots of little telltale signs, aren't there? Not getting enough sleep, not doing the usual activities that you do that provide you with joy, or not getting enjoyment out of those activities. Lots of like telltale signs like that. But I think it is fundamentally about just continuing to kind of knock on the door a bit, I guess, sometimes. And that shouldn't be a burden that just falls on women. That should be on everyone, obviously. And I know, for me, a lot of my close male friendships now, just from the people that I've kind of gravitated towards, are quite emotionally literate, I'd say. And I have very sporty masculine friends in some ways, but we tell each other we love each other, and we always check in, and everyone feels safe to kind of share if they're struggling with something. So I'm lucky to have that sort of community in my male friends. But of male relationships in my life that struggle more with that, and I do have them, and sometimes it's family members, sometimes it's kind of wider friendships groups. I think it is just checking in, really. Like, checking in makes a huge difference, and just doing that quite often, and picking your moments to suggest certain things.
Yeah, that's the thing, I guess. A lot of men may not have those type of relationships.
No, and it's really sad, isn't it? And I think that's true. I think you can have people in traditional male friendship groups who maybe meet up a lot, and they go to the pub and they watch the football and all these things, and they've got major things going on in their life, and they don't have female friendships, and they don't talk to their male friends about it, because that's just not what they do. And so either they talk about it with no one, which many men do, and I'm always amazed when I find out about men who basically really do suffer in silence and don't talk to anyone, because I just think how hard that must be, and it's not a choice for these people, and this is not rare, is it? This is kind of the norm. So it's not a choice for people to, if they really felt able to share and talk about their emotions comfortably, they do it. And some of them are really, it's either not having the emotional literacy because they've not grown up with, in their schooling and kind of culture and surroundings to train themselves in that, or to improve at that, or because societally they still feel that they feel shame about their feelings, and they feel that somehow it's a weakness to be vulnerable. And so for whatever reason, it's really tough for a lot of men.
Yeah, I feel like it's kind of a privilege in a way, isn't it, to be able to be in those situations where we're able to talk about it. There's like not only is there the privilege of education, and but also like the privilege of being around those people. Not everyone are in those situations, are they? But Layla, when she was doing her research as well, she said that so it was like 93% of men are going through fertility struggles say it affects their mental health, yet 42% haven't told anyone. So like you could literally just imagine like the amount of conversations that people are having within their heads, and like how they deal with that, because especially around fertility, it's a big thing, isn't it? You touched on earlier about that whole like that typical role of a man, and that can be so hard. Like, how can partners, I guess, create space? Because I guess there's also that worry about, you don't want to dip into that therapist role of being like, like females tend to talk a lot, don't we? We can openly have conversations with our female friends, but if I don't know, went to my partner and was like, tell me how you're feeling, he'd probably look at me like I was some sort of like loser.
But also I think just to add to that, if you're going through fertility issues as a couple, that it's more focused on the women always, isn't it? Because you're either having a miscarriage, you're the one that has to, your period comes if you're not pregnant. It's like the burden seems to fall on the women. So I think the spotlight kind of falls off the man, even if some of it is male factor, because he feels like he has to support his partner or his wife.
No, for sure. And I think, I'm definitely not an expert on this particular area, but it's just a really interesting thing to kind of reflect upon, isn't it? I think if you were to kind of think about the word fertility and talk to people about what their associations with that word were, people would kind of tend towards the woman in their mind, which is so bizarre, really, if you think about it, because, it takes two people to create
to
a baby.
tango.
And as you say, male fertility problems are so common. And there must just be a really, an incredible lack of education kind of in that area. I mean, even for me as a doctor, we really have not spent a lot of time in medical school training on male fertility or infertility problems. Whereas for, a lot of good reasons, we've done a lot of, training on women's health, but it's interesting that, it's both that men struggle to talk about that, but also societally, there clearly needs to be a bit of a revolution in talking about male fertility, doesn't there? Especially given those studies showing that, the sperm count has been kind of decreasing quite significantly.
So why is that? Like,
I don't know. When I've looked it up in the past, I've seen stuff about, environmental toxins and as potential theories, but I don't think there's any proof that any one thing has caused it. I think there are lots of very clever people trying to figure out what's going on there.
Yeah, I guess as well, like probably, again, this is hypothetically, but like when we see what affects a female fertility as this high stressful life, and we know that, stress is across the board these days, isn't it? So potentially if it's going to affect females, there's a high chance that would be affecting males too, right?
Sure.
Stress is,
isn't it
the one, isn't it?
Yeah.
We all suffer from, I think. So I'd love to hear more about how. So I know that if you don't mind talking about it, I know that your partner has some hormonal challenges. Do you mind us saying that she's no?
No. I don't.
We can cut it. Okay, we can edit this.
She said I could kind of talk about that.
Okay,
so I've kind of asked
all right, we can
got her
cut
permission.
Okay, cool. All right. So I'd love to hear more about as a man how you support your partner with hormonal challenges. I know that you've mentioned that your partner has endometriosis, which can be so challenging and takes so long to get diagnosed, and the impact on women is huge, like time off work, the amount of pain they have to go through, and it's also unseen pain, which, I know that lots of women when they go to the doctors they don't get that understanding just because you can't see it, but it's obviously, it's there and it's real for them. As a man, how do you support your partner when she's having a really difficult, challenging time?
Yeah, and most pain is unseen is the interesting thing as well, isn't it? Which we don't really. So many chronic conditions that people are living in chronic pain with, and you don't see it, and that's part of the problem. But we got together a couple of years ago, about 2 years ago. We're now engaged, but when we
yay, congrats,
congratulations.
When we first started getting together, within about 2 weeks, Tash started getting really severe kind of pelvic pain. And prior to that, she didn't get that. She always had relatively painful periods, but not kind of debilitating. And after about a couple of weeks of dating, she had a number of episodes of severe pelvic pain, where we thought something very serious was going on, like, maybe ovarian torsion or a miscarriage or something, kind of very acute and emergency was going on. Because of the level of pain she was experiencing, we went into A&E several times. And And this kind of happened quite a lot over a few months, and then ended up kind of, seeing the GP, and then getting some further kind of gynecological advice, and doing some of that on the NHS. And then in the end, just because of the crazy waiting list to see anyone that is vaguely specialist in this area, we arranged one appointment in the private sector with an endometriosis specialist, because by that stage we'd been told by enough doctors that this was probably endometriosis based on the kind of nature of the symptoms and some of the other symptoms that she was getting as well, and certain examinations. But unfortunately, it wasn't found on any of the ultrasounds or MRIs or things like that. And actually, the majority of people who have endometriosis, it's not found on imaging. The only way still to definitively diagnose it in the UK is to make, 3 surgical incisions in the abdomen and go in there and have a look.
Sorry, just to interrupt you. Sorry. In other countries, how do they? When you say in the UK,
well, I mean, that's how it is in most of the world. But I know in Europe there are, genetic tests now, saliva tests that supposedly have a, 97 to 98% kind of sensitivity that can pick up endometriosis. Why it hasn't been rolled out in the NHS yet, I don't know. I know some countries in Europe have accepted that though, so that's really interesting, and I really hope if the science is there on that does come to the UK, because the idea that you still need to
going through the operation,
major surgery on someone for a condition that affects 1 in 10 women to diagnose them is considering how far medicine come is crazy to me. But
that kind of makes sense why it takes so long for a diagnosis, doesn't it? And actually the stats I read did say usually it's after an A&E trip that when women usually get diagnosed, so it gets to like rock bottom before they actually finally get a diagnosis.
For sure. I mean, we've been in A&E many times because the pain is so, and she's a very resilient person, Tash, and she's not a complainer. She doesn't want to put anyone out. She's a machine in the CrossFit gym. She's unbelievably resilient.
Hey, I want Tash to be my friend.
She's great. But she experiences daily pain. I mean, it's cyclical to the degree that it's worse on her periods, but she is one of those of endometriosis that has, that experiences daily pain. And sometimes that pain is so debilitating she can't work. Sometimes it's so debilitating she has to go to A&E. And, we've got, it's a journey, it's a journey that she has to go through and we go through together, and trying to get the right treatment for her. And endometriosis is it's the only definitive treatment is surgically taking out the tissue. And even then, significant proportion of women will get a return of pain within a few years. So even, it's not like some other surgeries, you take out the appendix and maybe that kind of sorts the problem. It's not really the case in endometriosis. So you go through lots of different types of painkillers, lots of types of hormonal treatment, and you try, and I'm sure you've experienced a lot of this with your health stuff as well. But so we've gone through a lot of different things, and she's on a balance of medication that is okay for her at the moment, but it's managing it. It's not it doesn't get rid of the pain. She goes about her life as someone who has to experience very regular pain. I just can't, I'm in awe of how she does that, and how a lot of people in general, but a lot of women have to do that. 1 in 10 women have endometriosis. It varies a lot. I mean, there's no correlation between the physical severity of the disease, that is the amount of tissue and the pain. There's no correlation, which is really interesting, and that just goes into how bizarre and complicated pain is. But the fact is, from a kind of pain point of view, she's definitely at the severe end. And yeah, in terms of kind of being a good partner in that regard, I think it's just there's a lot of things, I think, and hopefully I do an okay job at it, but it's becoming knowledgeable on what's going on yourself, trying to take some of that burden, while I'm a doctor and maybe that helped a little bit. But to be honest, was certainly not an expert on endometriosis by any stretch of the imagination. The reason I became very knowledgeable on it was because of her, and because, in the beginnings of it, where she had no idea what was going on, and no treatment for it, she's just existing in a huge amount of pain every day. I felt it was my role to kind of become as much of an expert on it as I can, try and make sure we got the right appointments, looked at the right treatment options, advocated for her in appointments, and kind of take that role as an advocate, I guess.
I think that's really important.
Going in with your partner, with the questions that you want answers for from this appointment, which again, helps that I have the kind of the doctor hat on, although I was a medical student at the start of it, and just I don't know, just checking in regularly, asking what they need from you. With endometriosis, there's a lot of little things that you learn, and you learn things that help, stuff like, and it's different for everyone. So everyone has to go on their own journey with that, and you'll find millions of suggestions online and you can lose your mind about it. But for Tash, some things that help other than hardcore painkillers, which are not without their problems, things like heat packs. We used to heat up rice in a sock in the microwave. We gave it a name. And that would like go on a tell list. And there's lots of things in kind of nutrition and hydration and stuff that you can kind of help a little bit. And then also just not having any expectations that they should do anything more than they're able to right now. It's so difficult when you have a chronic condition, especially pain, and the amount you have to cancel on stuff with your friends. You have to do that. You have to put yourself first. If you're in debilitating pain and you can't go to a big social thing, you obviously should look after yourself and not. But if you're someone that doesn't like letting people down, is a social person, is a good friend, all of these things, you kind of have to deal with that fairly regular guilt of feeling like you're letting people down by just looking after yourself. And that's such a tough position to be in as, someone going through something like that. So I think that's obvious to me because I live it, but I would obviously never want Tash to do anything, do any kind of activity that was going to worsen her condition. I think as friends, we all have a responsibility with someone who has a chronic pain condition like that to kind of, or chronic condition full stop, to be so understanding of that, because that person wants to see you, they want to see people, they want to engage in life normally all the time, and it breaks their heart that they can't do that. But if they socialize like anyone else, willy-nilly, and not really worrying about their physical health, they will suffer the detriments for that. So there's a lot of stuff, and it's a lot of learning with it, isn't there, as you go. So
Henry, how does it affect you and your, I guess mental health? Like, does it affect your mental health? Like, what, take us it from a partner's perspective, I guess.
Sounded like my therapist. It obviously does. I always am able to fall back on the fact that I'm doing it right now, which I shouldn't do, but the fact that she's just going through so much more, it can actually empower me to be a bit more resilient. But she provides a space for me to feel to feel things when it's difficult for me as well. And I have very good friends that I can talk to, because when it first kind of happened, we'd been dating for about a week, and fortunately we fell in love and we want to spend the rest of our lives together. But it was a crazy thing really to be going through within a week of dating someone. It just so happened that that was the beginning of these really, really awful symptoms, and we were in and out of A&E many, many times over those first few months. So it was an interesting start to the relationship in that sense, and like a big test, I suppose. But we were also having a great time, and you know, despite all the pain and all the difficulties, we were also, you know, we were having a great time. We were falling in love, so it was all very nice in that sense. But it's been difficult. It's been difficult. It's really, really tough to watch your partner deal with the pain that they have to go through. I mean, really debilitating pain this condition causes, you know, pain that I've probably rarely experienced, and she has had to experience often daily. You know, feeling as though her insides are getting ripped out. I mean, I don't want to mince my words, but you know, it's that level. And if you've, you know, it can be on parallel to very severe things that happen in a woman's life, things like abortion and things like that. So, you know, it is tough, you know, from a mental health point of view, but you know, we have each other, and we have a really lovely support network as well. And yeah, I feel like I can talk to people about it when I need to. I probably normally downplay what I'm going through as well, but you know, it is that there should be a space for, you know, the partner as well in any kind of dynamic like this, whatever kind of health condition the other one has, you know, to also feel kind of heard and validated, because obviously it affects me. Like if it didn't affect me, I would have something missing in my brain, I think.
Yeah.
Yeah, I love all that, and I love the fact that haven't really thought about it in that way, that you can offer not only the emotional support to your partner that's going through something like this, but the practical support as well. Because I think when you're going through a traumatic time, whether it's fertility or, you know, like you were saying with endometriosis, it's so focused on the issue that you can miss things. So going, especially though with those doctor's appointments and going to the doctors and then realizing that you've missed out half your questions, or you can't remember what the doctor said. It happens so often. It happened to me so many times. So yeah, just having someone who's got your back, really.
No, I think that's a great point. And like, I will say, as an NHS doctor, you know, it kind of breaks my heart that I feel in many ways let down by the NHS and by healthcare in this country. And I don't feel like they have been there for Tash. And I feel that, you know, I've had to fight a lot to get her the appointments that she needs to get and the treatment that she should be considered for. And I'm a doctor.
Well, that's the thing, isn't it?
I'm in a privileged position.
Yeah.
You know, I can go to appointments with her as well, and I just kind of think about all the people, you know, millions of people kind of suffering with this condition. Millions, is that? I mean, maybe not. Well, in the UK,
there will be millions.
Certainly, certainly hundreds of thousands, right? In the UK, and you know, it's a mind map to get through. You know, I mean, you know the stats. What, you know, 9 years for endometriosis for someone to get diagnosed on average.
That's a lot of long time to be in
and you know,
pain.
Several years for waiting for, you know, getting the right kind of treatment. So difficult to see a specialist. It's a sad state of affairs, I would say, in many ways. But you know, there is help out there. Obviously, we need to kind of be hopeful in these things. It's just that you kind of need to be in a position to either to be able to advocate for yourself really strongly, or to have support with advocating for yourself. Because there's a real lack of, I think, education, even among kind of primary care physicians, in terms of what the treatment options are that are, you know, for conditions like this. So
yeah, it's so true. It is literally a wild ride for sort of everyone that's involved, right? Like you mentioned about the fact that it happened within like the first week of dating. I bet there was part of you that was like, oh, sorry, hang on a second. What is going on here? But we at the end of each podcast, we ask our female guests how they work with their cycle to support their hormones.
Might struggle to answer that one, but
yeah, exactly. Yeah. But from your time as a doctor and obviously in your own life, what's one thing that you think men could do to start supporting their hormones a little bit more? Because we know female hormones are sort of up and down across the month, but like men also have hormones, albeit a lot more steady. There is still a difference, right? And we are seeing that, difference in sperm. We are seeing like a lot more. I've seen a lot on people going on testosterone replacement therapy and things like that. So from your experience as a professional and also in your own life, what can men do to support their hormones?
Yeah, what a great question. And one I don't feel fully qualified to answer, but I'll give it a go. I think just kind of, if we're thinking that stuff like reduced sperm count is to do with environmental issues, I suppose getting out into nature as much as you can, obviously adequately hydrating, having a healthy diet, wide ranging, healthy diet, good nutrition, and then regular exercise, I think, is probably the main one. Trying to do some form of exercise every day, even if that for you is, just going for a walk, but hopefully a few times a week doing something that, breaks a sweat. I think would do, lots of evidence of it that would do great things for hormones, but also kind of mental health and physical health in general. Quite broad answers there, but
cool. Actually, I do have a more want to kind of broaden that point on testosterone therapy. So, because I'm on TRT for perimenopause, which has been incredible, like life changing, I would say. But would you say that a lot of men do need to go on testosterone therapy? Because it's not something I think that would spring to a man's mind once he reaches a certain age. Or maybe there's younger men in their 40s or 30s that need it. What's the situation with TRT in men, and what does it do? And because I'm sure I know how I felt before I started taking testosterone, just really lethargic, just felt really meh, just lost my mojo completely. And after, I feel back to my normal self. And there must be so many men going through a similar thing, but have no idea that it's their testosterone levels that have gone down.
That's fascinating. No, I mean, I really don't know is the honest answer. So I won't even try and take a stab at answering that without the.
But I think
that's really interesting, and I think certainly greater awareness and greater testing would probably be a good thing, wouldn't it? Just testing more men for levels of testosterone and seeing the population that are deficient, and
it would be interesting to know that, actually, because I expect it's probably quite a big issue amongst especially men in their 40s and 50s.
Yeah, and I also think, like, with this whole trying to open up the conversation around hormones in general, like what you said earlier about like mental health with men, like we're still so early in that journey that actually, as we continue on this journey of talking about men's mental health, also along this journey of women's health being taken a lot more seriously, we might see sort of like the two merge that naturally leads sort of a little bit more into each other as well. But Henry, thank you so much for joining us. That's been so insightful and incredible to hear Tash's story and how that's also you've been able to support her, and also how it's affected you, but also along the sides of how the fact that there are things out there that men can do. Like I said, I would like Tash to be my best friend, please. So if you could pass her along my email, that would be fab. Yeah. But where can everyone find you if they want to just see more about what you're up to?
Yes, I've got kind of research that you can just find from looking up my name on Google Scholar, or I'm doing a lot of kind of social media, mental health, evidence-based kind of content creation at the moment. So if you're interested in that, I'm on Instagram at Dr Mental Health. So that's Dr_mental health. So give me a follow if that interests you.
Yeah, amazing. Thank you so much. Guys, if you are listening to the podcast, as usual, please come over, join our WhatsApp group where you'll find hormonal chat and support in there. And of course, follow at My Over Care on Instagram as well. Henry, thank you so much. And Sudden and I love to Tash as well.
Yeah, will do. No worries.
Thank you.